Nurhalila Buari, and in this video, I'm going to share with you the topic for OPT435 Ophthalmic Optic Bifocal Lenses. This bifocal lenses topic is intended to describe the bifocal and trifocal lens dimension, explain image jump in bifocal lens wearer, and also describe bifocal lens fitting. In young people, the eye's lens is soft and flexible, readily changing shape to see images from different distances. The image is clearly focused and fall onto the retina. As we age, the crystalline lens in our eyes hardens and loses elasticity. With this loss of flexibility, the eyes are less able to adjust properly to focus near objects. In this situation, the patient might having presbyopia. Depending on the individual, presbyopia may be treated with corrective eyeglasses or contacts, or with refractive surgery. Whatever it is, they need a plus lenses to make near image clear. There are a few options for that, which include bifocal lenses. Bifocal are lenses that offer two different prescriptions in a single lens. It allows for clear vision for both long distance and close-up work within one pair of spectacles. The bifocal lenses can be divided into different types based on the shape or size of the segment, which the additional plus power for near. This is the uncut diagram of the bifocal lenses. The segment height is the vertical distance from the segment top to the lowest tangent to the bottom of the lens, either uncut or cut lens, whereby the segment drop or vertical segment displacement is a vertical distance between the distant optical center and the segment top. The segment diameter or segment width. For the segment where the dividing line is circular, the diameter of the circle of which the boundary of the finished segment form a part. There are 5 types of bifocal lenses that will be explained in this section. The first type of bifocal lens we want to mention is the round segment. The segment is either 22 or 24 mm in length. It has optical center that always at the center of the segment. This design provides easy adjustment between the two different sections of vision. However, this type is very rarely used nowadays. This is a kind of common bifocal lenses. The lower part of the lens is present in the shape of half moon or the letter D on its side. The upper part and the lower part of the lens can be clearly distinguished from each other. The patient using such a bifocal lens has the choice of choosing the length of the lens segment, which is either 25 mm or 28 mm. The third type is a curved top and panoptic. Curved top is similar to flat tops, except that the upper line is arched, distinct point on the other corner. Top of panoptic segment are curved as well, but the corners are more rounded. The other types of bifocal is a ribbon segment. It is a round segment with top and bottom cut off. It has a bottom area of 9 mm deep and a round segment of 14 mm depth. The last one is the executive segment. In this type of bifocal, the lens is separated completely from each other, and the upper part of the lens and the lower part of the lens are divided into two equal halves. There is a distinction line and it is visible. To improve the cosmetic appearance of the bifocal lenses, the edge of the segment will be blended to conceal the dividing lines. Therefore, the blended bifocal was appeared in the market. The blended bifocal is also called the invisible bifocal, seamless, or blended 28. Irwin Reeves is credited with inventing the first blended lenses in 1955, creating a younger aesthetic look. The segment width of the blended bifocal is 28. The lens design is cosmetically the best looking lens of all the bifocal, showing virtually no sign of a segment. The blended area has annulus around addition with 3 to 5 mm width. However, it is unusable by wearer due to the induced astigmatism. There is no progressive zone in terms of refractive power. This blending range has a distorted perspective that can be proved to be non-adaptable by some patients. This figure illustrates area of astigmatism seen in blended bifocal, which is the raised annulus. It is due to the change in the curvature at the blended zone. However, it depends on the width of blended zone and the power of near addition. The wider the zone, the lower the annulus, which might reduce the astigmatism, but larger unusable area. The fitting requirements for bifocal should provide equal clarity for distant and near reading. However, it will depending on the form of the lens and also context between components. The distant point should be coincide with the main reference point unless prism is prescribed at distance. The near point should also be coincide with the near reference point. If the optical near point is not coincide with the near reference point, we need to adjust centration to compensate with this situation. Jump is defined as a sudden introduction of base-down prism at the dividing line. As the wearer of a bifocal lens looks from the distance to reading, the eye will cross the dividing line of the reading segment at this point, and there will be a sudden introduction of base-down prism. To the wearer, this will appear as if object jump or move outward, which usually in the vertical direction. The factors that might contribute to image jump are 1. The distance from the optical center of the segment. The further the eye moves from the optical center of the segment, the larger the effect of image jump. Number 2 is the addition power of the lens. The effect of the image jump can be calculated using Prentice rule, P equal to CF, where P is the prismatic effect due to jump, C is the distance from the dividing line to the segment optical center, and F is the addition. The amount of image jump of bifocal is independent of the power in distant portion. Image jump in bifocal lenses was found to be maximum for the round segment bifocal, and the effect is quite minimum for the flat top segment bifocal. Interestingly, there is no image jump effect for the executive segment bifocal. How do we fit bifocal lenses? Is it the same with the single vision glasses? Where should we locate the segment so that they will see through the segment during near work? Which segment type and size do we need to choose best for the patient? For the next section, I will explain on the fitting of the bifocal lenses. Whatever it is, the aim in bifocal lens is to provide equal clarity for both distant and near. For conventional bifocal fitting, the near segment should be ordinarily be located with the segment top at the lower limbus for the wearer to be able to comfortably utilize both the distant and near portion of the lens. As illustrated in the figure, the segment top position should be in line with the lower limbus. While many practitioners use the lower lid position as the segment top reference position, it must be remembered that this point in relation to the pupil center may vary greatly. For example, if the patient has ectropion or asymmetric eyelid, the lower limbus position is a more consistent marker. In the case where the lower limbus is hidden due to a narrow palpebral aperture, the lower limbus must be estimated to place the segment of the bifocal. What we have learned for this topic, we have learned what is bifocal lenses, the type of bifocal lenses, the image jump in bifocal, and also bifocal lens fitting. I hope that you enjoy this topic and see you in another topic. Thank you. Bye.